Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine plus urgent care. The theme of our Health Talk today is 5 years down the COVID. What have we learned so far about the viruses? As you can all read and hear on the television, there has been an insurge of measles virus. So what I decided to do, I did some research studies on the measles virus, its origin, the history, immunization, and I'm going to share with you with my slides. Slide 1, please. The measles epidemic in United States. What have we learned? This is 5 years after the COVID-19. There is still the side effects of COVID-19 on our individual. It has been lingering, and on the top of the tab of that now we have got an epidemic or pandemic, whatever you call, about the measles virus in United States. Next slide, please. So now we all know, back at home several years ago, we used to see cases of the measles. Here also, while during my practice of pediatrics, urgent care, I had encountered cases of measles, German measles. However, now we don't see that because there has been eradication of the measles virus due to the vaccine. So as we all know, it is a highly communicable disease. Also, other name for measles is the red measles, morbil rubiola, or English measles virus. What are they? They are a single-stranded RNA virus. And when I went back to the history, I found that it was first described by a Persian physician, Reis, 860 to 932, and it was mentioned in the book of smallpox and measles. And by the way, at the end of my slide presentation, I have included all the bibliographies from where these informations were obtained. The first measles vaccine, very interesting to know, it was developed in 1963. And the virus is called Edmundston strain. I will go through more detail about this. So the World Health Organization Global Vaccine Action Plan, they aimed to eliminate measles and rubella by 2020. Next slide, please. So what is the pathogenesis of measles virus and what is the impact of vaccine? As measles virus, it is transmitted through the airborne respiratory tract by the droplets from the infected individual. What it does, this is a single-stranded RNA virus, and it attaches to the epithelial cells in the respiratory tract, tracheal mucosa. The discovery of measles, mumps, rubella vaccine reduced the measles-related mortality, especially in developing countries. 20th century vaccine advancement led to eradication of other diseases also, besides measles, that is smallpox or yellow fever. So according to the World Health Organization, they eliminated measles and rubella by 2020. Next slide, please. But measles outbreak happens. It starts from the third world countries. It spreads across the border. There has been, as all of you are reading with the newspaper, television, Texas outbreak in 2024, 2024, 2025 linked to this virus to the unvaccinated travelers from underdeveloped countries, affecting all the age group, especially the children and the elderly population and the immunocompromised individual. So the recent statistic I went through since January 2025, 259 have been the reported cases so far, with 34 hospitalization and 1 death. What is the contributing factor? Lack of immunization. Lack of immunization by the vaccine. Next slide, please. So what happens, how do you detect the measles virus in the blood? There is an IgM antibody detection in the serum samples, and this antibodies IgM develops within days of rash onset. The CDC recommended anytime any patient with a suspicious case of measles, also traveling overseas and coming back, crossing the border, recommend a nasopharyngeal and the throat swab test for clinical cases. There is another one, the RT-PCR serologic testing, which detects the IgM antibody. This IgM antibodies in the blood appears 3 to 10 days after the rash. And then what happens 3 to 10 days and follow-up of the serum for the serologic testing will confirm the diagnosis of the measles, because there is elevation in the IgM antibodies. Next slide, please. So now, coming back to the clinical features, we are working in the emergency room, working in the urgent care. My own pediatrics practice, I have seen a lot of cases in the past. Measles, German measles, and measles, German measles. So early symptoms of measles include cough, running nose, sore throat, and the inflamed eyes. Eyes are red. Koplik spot. What are koplik spot? I always, when the patient comes to me, I always do a general physical examination plus look at the mouth. Inside the mouth, there are whitish pearl-like spots around the buccal mucosa, and they signify the presence of koplik spot. So, what are the 4C I remembered from my past experience about measles? Cough, coryza, conjunctivitis, and koplik spot. And also, just so that we know, this rash starts on the face and neck, and then it spreads to the trunk and the thigh and the feet. Next slide, please. So, what are the risk factors and then complications of measles? There is a lack of immunization in children and adults. Immunocompromised individual who have some underlying chronic diseases, and this also includes the children as well as the elderly. International travel to the areas where there is a low vaccination rate. Vitamin A deficiency. Now, what are the symptoms of measles early? Early, it is diarrhea and vomiting. Diarrhea and vomiting develops because of the poor oral intake. Ear infection, very common in the children. Respiratory tract is, once the virus goes through the tracheal mucosa to the lungs, there is the symptoms of croup, bronchitis, and pneumonia. very rare cases. I went through the research. Very rare cases. There is an reported cases of encephalitis with the virus. That is the virus affecting the brain, and of course complications of pregnancy. Next slide, please. So measles vaccination. The, the CDC recommends the measles, mumps, rubella vaccine. The schedules usually is 12 to 15 months of age. Second dose is given between 4 to 6 years before the school entry. Catch-up vaccinations for the non-immunized individual by CDC and the World Health Organization. Next slide, please. So, before I end up my chapter, I want you guys to know that I have included in my bibliography CDC, World Health Organization, and every other sources where I have collected all the information. The bottom line is the pearl of my talk is to stay completely immunized before somebody decides to go to the third world countries or cross the border, like from Texas, with all these diseases. Measles have started, and now they have crossed the border to Washington and other areas. So basically, what it is, person should be completely immunized before they travel, or when they come back from their travel, they should be seen by their physicians, by the infectious disease, just so that if there is any glitch in the immunization, they can be overprotected. So now what's keynote advice I have? Stay immunized. Travel medicine is a very important site where you can always go, and they will give you a whole information of which area has got the measles. And immunization, so far as is concerned, the CDC has recommended the complete set of immunization, and I have given it in my bibliography, where you can have a complete series of immunization for the children, for the adults, and for the senior citizen. Now, before I end up my talk, just today I saw in the television, CNN has reported cases of Q fever, psittacosis, the parrot's disease. And these birds are noticed in some areas of the third world countries. And once they die, their secretions, their excreta goes to the human being, contamination. So this is another reported cases of Q fever. I haven't read anything more about the smallpox. However, always keep that in mind. So this is the end of my podcast today about, and in my next series I will go more in details about the rare viral diseases that are coming to the United States. And I like to thank you, my producer, for preparing this wonderful videos. I like to thank Kush, who is a graduate student, helped me in producing my slides. Until I see you guys again, have a very safe spring and summer. And also, if there is any questions that anybody wants to ask from my from my health talk, kindly contact the television www.bloomfieldtownship.org and leave the question, and I will try to fill it up. I will try to do some research, and I will have the answers in my next podcast. Thank you again.